Hello, and thank you for joining today. I'm with Cigna, and I will be reviewing your medical plan options for this year, starting November 1st with Cigna. This year, you will have 2 medical options to choose from. Next slide. So let's discuss some common insurance terms. This is really meant to be a review to you to help you feel more comfortable in navigating your benefits. So starting with your premium. This is the amount of money that you pay your health insurance every month. Your network is a group of doctors, hospitals, labs, and other providers that your health insurance contracts so that you can make visits at a pre-negotiated and often discounted rate. The deductible. That's the amount of money you need to pay out of pocket before your insurance kicks in. Copay. A predetermined dollar amount you pay for visits to the doctor, prescriptions, and other healthcare services. Coinsurance. This is the percentage you pay for the cost of covered healthcare services after you've met your deductible. And finally, in-network out-of-pocket maximum. This is the threshold on your out-of-pocket costs for the plan year. Once you reach this amount, your plan will cover the rest of your qualified medical expenses for the year. Next slide. Your employer is offering 2 plan options to choose. Cigna's Point of Service Network, or POS for short, and our SureFit network. We'll look at the details of each network on the next slide. I'll start off by highlighting some key features of the Point of Service Network. Within this network, you work with your primary care provider, or PCP, to get the most out of your plan. So here are some crucial notes for your options for care. You do need to choose a primary care provider as your personal doctor. Each family member covered through this plan can choose his or her own PCP and can choose them at any time. In-network. For your care to be covered by the plan at in-network levels, you must choose a primary care physician who is in the Cigna network and receive all your care through that PCP. Your PCP can refer you to a doctor or facility outside of your plan network. However, it will be a higher cost to you. Referrals for specialist care. Your primary care physician will give you a referral if you need to see a specialist. However, you do not need a referral for an OBGYN service. You may need pre-certifications for hospital stays and some types of outpatient care as well. If you use in-network healthcare professionals, there will be no paperwork for you to fill out. On this plan, out of network, you have the freedom to visit doctors or use facilities that are not part of the Cigna network. However, again, your costs will be higher and you may need to file a claim out. Emergency and urgent care should be used as needed, and you will have coverage in any event that it is an emergency. Next slide. With this SureFit plan, you can consider it an HMO plan. You will work with your primary care physician again to get the most out of your plan. The options for care on this plan do require you as well to choose a primary care physician as your personal health advocate and to coordinate your care. Again, each family member on the plan that will be covered can choose his or her own PCP and can change them at any time. In-network. To receive coverage under your plan, you must choose a primary care physician who is in the Cigna HMO network, and it's called SureFit. Do note, before enrolling, you must make sure you live within a zip code covered by the plan. The locations that SureFit is under is Dade, Broward, and West Palm Beach counties only. Again, your primary care physician will give you a referral if you need to see a specialist. Again, you do not need a referral for any OBGYN services. For out-of-network, if you see a doctor who is not in the network, you will not receive coverage except in emergencies. Again, if you do need to go to the emergency room When you need care, you will have coverage. If you have questions throughout the year regarding which network you are on or where to go for services, please feel free to call the Cigna number that's on the back of your ID card. It is a 24/7 service number, and they can assist you, and they're available to talk day or night. Next slide. So now that we've reviewed the network, we'll go through the plan options for this year. Starting from left to right, I'll give you a high-level overview from the plan and some call-outs from what you can see on the slide. Your point of service plan. You'll notice you do have in and out of network coverage, but I'm truly going to focus on the in-network coverage because using doctors and healthcare facilities in the Cigna network may keep your costs lower. Again, Cigna has contracted rates with these providers and facilities. Starting with the annual deductible, or what we like to call the first dollar down out of pocket, family members meet only their individual deductible, and then their claims will be covered under the plan's coinsurance. For example, you can see that the deductible for an individual is $2,500 and $5,000 for the family in network. Moving further down, we'll look at the out-of-pocket maximum. Remember, this is the max dollars spent. Then the plan will pay 100% of covered services for the plan year. Please note that there is a prescription out-of-pocket maximum as well on both plans. Next, you will see the coinsurance for each option. Note that the plan pays 80% in-network and 60% out-of-network. That means if you stay in network, you're responsible for 20% of the cost of that negotiated rate where the deductible applies. Both plans have set copays for office visits with your primary care physician at $30 and $50 to see specialists. So providers such as gastroenterologists or cardiologists will fall under a specialist. I'll skip down to a major call out here, which is your diagnostic services on this plan. Do note your labs and x-rays are covered at no cost when you stay in network. We still encourage using freestanding facilities unassociated with a hospital when you can. Next is the emergency room, which should be used for true emergencies such as shortness of breath, tightness of chest, a loss of limb, a head injury. Emergency rooms tend to be more costly than urgent care facilities or primary care physician visits, so you really should use them only in its true emergency. Urgent care facilities can treat non-emergent conditions. Ailments may include things like a minor burn, sprain, fever, and flu-like symptoms. You can always utilize My Cigna as well as the app to look up in-network urgent care facilities and estimate costs. I'll go into the next slide where it's a bigger view of your pharmacy benefits. So here are your prescription options. Tier 1 or a generic medication is a $10 copay. Tier 2 or preferred brand name is a $30 copay. And non-preferred brand name Tier 3 is a $60 copay. This is the same for both plans. Remember, you can pay less than this amount, especially with generics, if you do a small research with many retailers. Some of those are considered Publix, Walmart, even Target offers these generic brands at $4. Next slide. So knowing where to go is very important. So we're going to go through the options that are available to you that will take less time and money spent versus those that are more time and money spent. So telehealth, also known as virtual care. You would use telehealth or virtual care to treat minor medical conditions. It does allow you to connect with a board-certified doctor via video or phone, when and where and how it works best for you. We encourage you to register ahead of time on MD Live. You can also visit mycigna.com to see where to register. The use of virtual care would be for colds, flu, rashes, sore throat, pink eye, ear infections. Costs are the same or less than visiting your primary care provider, and no appointments are required. Your meeting with the doctor will typically be about an hour or less. Convenience care centers, those treat for minor medical concerns. They are staffed by nurse practitioners and located in retail stores and pharmacies. They are open nights and weekends, and the primary use for this service would be for cold, flu, rashes, as well as vaccines. No appointment is needed as well for this service. Your doctor's visit, that's going to be your best place to go for your routine or preventive care services. They're there to keep track of your medications, provide you with those referrals to see a specialist, and so forth. The use for a doctor's office is typically for general health issues, routine checkups, immunizations, and screenings. Urgent care centers. This is for conditions that aren't life-threatening, however, they are staffed by doctors and nurses. They usually have extended hours as well. You would use this for a fever, flu-like symptoms, minor cuts, sprains, burns, rashes. They can even provide stitches for lacerations. It's going to be a lower cost than the ER, no appointments are needed, and less time waiting. The emergency room, used for immediate treatment of critical injuries or illness. As we know, they're open 24/7. If the situation is life-threatening, at that point, we would encourage you to use the ER. Some common uses are sudden numbness, weakness, uncontrollable bleeding, seizures, shortness of breath, as I mentioned. Keep in mind, this is a higher cost than the others mentioned. No appointment is needed here either, and wait times are usually about 4 hours. Do note, again, Cigna is a 24/7 line. So if you call the number on the back of the card and it's not a life-threatening situation, you can reach our health information line where they can assist you in finding the best location based on your needs. Virtual care. So your health plan includes access to the medical virtual care. You can utilize MD Live. As mentioned, board-certified doctors, pediatricians can diagnose, treat, and prescribe most medications for minor medical conditions. Next slide. So the single best way to keep your healthcare costs down is maintaining a healthy lifestyle. You can reduce your chances of developing a chronic condition, or if you currently have any conditions, you can ensure you are managing them well when you participate in preventative care measures. Preventing diseases before it starts in a critical stage does help you live longer and a healthier life, as well as keep healthcare costs down. Preventive care services can also help those with early stages of disease and keep you from getting sicker. Keep in mind, preventive care services are covered at 100% in-network. Some typical services include annual well visits, women's well visits, and immunization. Next slide. Another way to better manage your healthcare costs is to stick with lower costing labs. If you use a national lab, we highly suggest Quest Diagnostics and or LabCorp. You can save up to 75% using these labs versus a national lab and using other national labs. Next slide. Great. So places to get your procedures done ultimately can be very costly. Sometimes when your doctor refers, we want to ensure that you do your due diligence as well to double check the cost of the services. We'll show you in the next slide how to do so, but keep in mind that outpatient surgeries in this example are typically less costly than going to the hospital to have those surgeries done. So we encourage you to use the MyCigna locator as well as cost estimator tool to look for in-network freestanding outpatient centers. You could save hundreds of dollars. These facilities specialize in certain types of outpatient procedures, and they offer the same quality care, similar to a hospital, but at a lower cost to you. Next slide. So this is what the Find Care and Cost Estimator tool looks like on both the website as well as the app. It will provide you with a cost comparison at different facilities, and costs can vary significantly by providers. So we encourage you to use this to get an estimate of how much an upcoming procedure or medication may cost. Next slide. So this is an example of being able to use the prescription lookup tool to view medication costs based on your pharmacy plan. It will let you know if there are lower cost alternatives, compare prices between Cigna home delivery and retail pharmacy, and it even has a pharmacy locator. So it will let you know if you can participate in Cigna's Express Scripts pharmacy home delivery option. So do keep that in mind. It's normally a lower cost than retail pharmacies. Next slide. An opportunity for ease with your prescription medication is Cigna's partnership with select retail pharmacies to offer a 90-day prescription. So you can find which retail pharmacies offer this deal, this option, by visiting the My Cigna site. The most common pharmacies are CVS and Walmart. And what happens is if you visit one of those pharmacies, they'll offer you a 90-day prescription. However, if you go to another pharmacy, you'll still be able to fill your prescription. It just will be the normal 30-day fill. Next slide. The pre-certification process is pretty important to know. And if you view these examples listed on the screen, they're the most common types of services that require a pre-certification. And what that is your doctor will send a request to Cigna to confirm that this service can be provided to you as a member. If the services are not approved, you as the payer will be fully responsible for the cost of the service. So it's important to wait to receive approval from Cigna first prior to going through with these services. You can always call Cigna's number, which again is 24/7, to confirm that it's been approved if you haven't received something in the mail. Next slide. The Cigna One Guide service can help you make smarter, informed choices and get the most from your plan. It is Cigna's highest level of support that combines the ease of the powerful app with the personal touch of live services. One Guide's personal support team provides tools and reminders that can help you stay healthy and save money. Help from our One Guide team is accessed through the normal way on the back of your card by calling, as well as the chat feature found on mycigna.com. Next slide. So we're encouraging you to please register today if you've been on the plan before, and if you haven't already, please download the app. If you are new to benefits with your employer, you will need to wait till your plan's effective date. MyCigna houses the details of your plans, the ability to view your ID cards, track claims, as well as details about our free coaching programs to quit smoking and pre-diabetes. You'll even find here a discount program for gyms and meal delivery services. So please register and explore the website. Next slide. So to recap, you are able to reach Cigna by phone, through the website, and through the app. Don't forget, there is a chat feature available if you prefer that way. Next slide. Employee contributions. Okay, please refer to the information provided by the benefit counselors when contacting the call center and via Employee Navigator. New contributions are going to go into effect November 1st, 2020. Thank you again for joining this presentation. Have a great day.